Welcome back. It's News at 5. I'm Beth Haynes. Today is National PTSD Awareness Day. The disorder affects thousands of people each year in many different ways. We're joined now by Dr. Kupfner to learn more about PTSD. He's a psychiatrist with Peninsula Outpatient Services. Really appreciate you being with us.
Thank you.
I tell you, with the military and veterans, we've all become familiar with the disorder PTSD. But let's talk about it because it affects other people, outside of the military. So how do you define PTSD?
Well, PTSD can affect anybody equally, no matter if you're in the military or not. Of course, you're going to have more traumatic events in a military situation, so that's really where we've sort of done the most research on this disease. PTSD, the T stands for traumatic, so you have to have experienced a really traumatic event, so it could be like life or limb threatening, or you could be there and witness it. So if you were in like a hurricane disaster zone, what happens is that the brain starts to lay down memories, and our emotional memories are much stronger than just the regular cognitive memory. It's a different part of the brain when your adrenaline is turned on, and the memories are much stronger and last much longer. So that's a normal response. When it keeps replaying when you're a long time after the event, and you keep reliving and re-experiencing this event, that's when we...
And you can't control those thoughts.
You can't. You get flashbacks, they'll like come on out of nowhere, or there can be a stimulus that'll provoke it, but you'll get that intense fear reaction. You might start to avoid things that you would normally do just to avoid running into a chance that might happen. It would be like, you can imagine how debilitating it would be if you were in a car wreck and that was really traumatic, and suddenly you couldn't be around cars. You wouldn't be able to go to work. So this can be a really debilitating illness.
And life-altering, certainly, for a lot of people. We talked about, other types of people that might be experiencing this, and you said, obviously, traumatic events. You're seeing more cases in women, right, than in men?
I think the prevalence for PTSD is about 7%, so about 7 out of 100 people have symptoms of PTSD. And of those rates, it was lower in men than in women. Women, all of us are expected to experience at least one life-altering event of severe trauma. Those are just the averages. In the cases of women, it's just believed that their trauma they're more likely to run into the kinds of trauma which would lay down the hard memories for PTSD, so more severe trauma. Yeah.
You said these flashbacks. What are some other symptoms of PTSD?
Well, they're going to have nightmares. We can't control what we do when we sleep, so that's really disturbing, causes sleep disturbances. The biggest, most problematic symptom is hypervigilance. So like your adrenaline system gets turned back on and you're re-experiencing the trauma all over again, and you didn't ask for it. It just came on out of nowhere.
Oh my goodness. What about kids? Can they develop PTSD?
That's a great question. Now, they haven't studied rates in PTSD in children, but it is known that kids less than 10 years old are actually less likely to go on to develop PTSD after witnessing or being a part of a severe trauma than kids 10 or older. So the young
Why is that? That the brain just doesn't remember what?
Well, the best part of the answer is the brain is still developing at such a rapid rate that probably new pathways can be reprogrammed and worked around. So a lot of times really young kids tend to develop more of those emotional memories when the grown-ups around them are really distressed during the trauma, as opposed to just experiencing it themselves.
Why do some people experience, two individuals, they experience the same traumatic event, why some develop PTSD and others don't? Okay,
well, there's a lot of research going on in this area, and there are some genetic causes and cues, certain neurotransmitters that will be hyperactive in one person versus another, but that's a great question. That goes back to saying, like, why two kids, well, one of them will develop PTSD for a lifetime and one of them doesn't. It's a magical concept we call resilience. Some people are just more hardwired to be able to handle trauma and move on from it. It's got to do with the way that the adrenaline actually affects your brain when you're in the middle of the trauma, like when it starts laying down the new memories and where it's mapping those memories. So some of us just don't get hardwired right into the middle part of the brain where the emotional memory is.
Can you fully overcome PTSD, or is this something you have to battle the rest of your life?
There are grades of PTSD. Certainly many people have overcome PTSD. There are medications that help, and there's a lot of research in our veteran population to help with medications administered quickly after trauma that may help block that adrenaline response and the hardwiring memory. So it's an anxiety disorder. Some people will battle it for a lifetime, and others are able to get through it with therapy and medications in many cases.
All right. Thanks for coming on.